Prostate cancer is the most common cancer in men in the UK, but here's the challenge. In its early stages, it often has no symptoms at all. That's why knowing the signs, understanding your risk, and making informed decisions about testing can be life-saving. Let's start with some perspective. In the UK, around 52,000 men are diagnosed with prostate cancer each year. That's about 1 every 10 minutes. It's the second leading cause of cancer death in men after lung cancer. But here's the hopeful part. If caught early, the survival rate is excellent. Over 90% of men survive 10 years or more. The problem is that early prostate cancer is often silent, so we rely heavily on awareness, risk assessment, and targeted testing rather than symptoms alone. Prostate cancer risk isn't the same for everyone. Risk rises sharply after the age of 50. Black men have about double the risk. Roughly 1 in 4 will develop prostate cancer in their lifetime. And if your father or brother had prostate cancer, your own risk is more than doubled. The risk is higher if they were diagnosed before the age of 60. Certain inherited mutations in genes like the BRCA2 also increase risk. If you fit into a high-risk category, NICE recommends having an informed discussion about PSA testing from age 45, rather than waiting until later. In the early stages, prostate cancer often causes no symptoms. When symptoms do appear, they can mimic benign conditions like BPH or prostatitis, like difficulty starting urination, weak or interrupted urine flow, frequent urination, especially at night, or urgency to urinate, or seeing blood in the urine or semen, or new onset of erectile dysfunction. It's important to remember, having symptoms doesn't automatically mean cancer, but it does mean you need to get checked. PSA stands for prostate-specific antigen. It's a protein made by the prostate gland, and a small amount naturally circulates in the blood. The PSA test is a simple blood test, but it's not perfect. A raised PSA doesn't always mean cancer. BPH, prostatitis, urinary tract infections, recent ejaculation, or even vigorous cycling can all temporarily raise PSA. A normal PSA doesn't always mean no cancer. Some aggressive cancers produce little PSA. That's why we don't use PSA as a single yes or no test. We interpret it alongside age-specific PSA reference ranges, symptom history, digital rectal examination findings, and risk factors. If PSA is high, the next steps may include repeating the test after a few weeks, an MRI scan of the prostate, and in some cases, a targeted biopsy. So why does the UK not have routine PSA screening? Unlike breast cancer screening in women, there's no NHS national screening program for prostate cancer. Why? Because mass PSA screening could lead to overdiagnosis and overtreatment, finding cancers that would never have caused harm and putting men through unnecessary biopsies or treatments with side effects like incontinence and erectile dysfunction. Instead, the NHS follows the Prostate Cancer Risk Management Program. Any man over 50 or over 45 if high risk can request a PSA test after a discussion with their GP about pros and cons. So when should you see your doctor? Immediately. Persistent urinary symptoms or blood in urine or semen, or unexplained back, hip, or pelvic pain, or unexplained weight loss or fatigue. If you've got any of these, you should talk to your GP immediately. The treatment options if diagnosed with prostate cancer, if caught early and still localized to the prostate, options include active surveillance, so monitoring the cancer with regular PSA, MRI, and occasional biopsies if it's slow growing. There's surgical option, which is radical prostatectomy, so taking the prostate out, and radiotherapy, sometimes combined with hormone therapy. For advanced disease, treatment may include hormone therapy, chemotherapy, or newer targeted drugs. Prostate cancer is common, but it's treatable, especially when found early. The challenge is that early cancer often doesn't shout. It whispers or says nothing at all. That's why knowing your risk, being aware of subtle changes, and having informed discussions about testing are crucial. If you're over 50 or over 45 with high risk, have that conversation about PSA testing with your GP. And if you've had symptoms, don't wait, get checked. Awareness and early action can save lives.